And we are live back here in studio on the Now Morning Show. This is TTT and we're with you all the way for 2 hours, Carrie and Lisa. And you know what, guys? PAHO is sponsoring the training of government laboratory staff from Trinidad and Tobago to be able to test for COVID-19. And this is part of the government's plan to expand testing, including to primary, secondary, or tertiary contacts. And on the line to tell us more about it is PAHO and WHO representative for Trinidad and Tobago and the Dutch Caribbean, as well as virologist, Dr. Erica Wheeler, who is no stranger to us all, and Dr. Oura, Christopher Oura from the University of the West Indies. Good morning. Good morning, Dr. Wheeler and Dr. Oura.
Good morning. How are you?
I am doing very well, thank you. And it's a pleasure always to have both of you on the program. I'll start with Dr. Wheeler. Dr. Wheeler, tell us about the initiative that PAHO is undertaking to sponsor the testing, the training with regard to testing. Okay, Dr. Wheeler, I think your microphone might be on mute. And as you get your...
Yes, it is. Yes, I'm good. Good morning. Good morning, everyone.
The technology, we're working our way around the technology. Yeah, so tell us about this testing, the sponsorship of testing by PAHO.
Okay, thanks, Lisa, and good morning again to everyone. So a few weeks back, the government requested PAHO to work with them to expand the testing in Trinidad and Tobago, because currently we have CARFA that does testing for Trinidad and Tobago and some of the other islands. Mm-hmm. But given the need to, as the Director General said, test, and test, mm-hmm. and as you correctly said, to follow up not just on those who were already tested and proven to be positive for COVID-19, but also for their contacts, the persons they've been in contact with, primary, secondary, and tertiary. They put a request to PAHO, and what we did was we then in Trinidad and Tobago reached out to our regional office, and we have a specialist, Dr. Lionel Gresh, mm-hmm. who will be on Wednesday. He will be doing the specific training for COVID-19 lab staff. But I just want to say that this really is an effort not only by PAHO, of course, but also UWI, and we have Dr. Oura there to talk about what we will be doing. And in fact, we start today, which is great news. We start this morning at 9:30. Yeah. So it is UE, the Ministry of Health, of course, whose staff we are training, and CARFA will be part of the training, so that when the initial training is over, there will be people locally who can continue to support this effort. So it is really capacity building as well for local persons. So we're really pleased to be facilitating this for the next 2 days.
And when you're talking about government labs, this would be where, located where? At the various RHAs?
So we have the Southwest Regional Health Authority, but we also have the Eric Williams Medical Lab, and we have the Trinidad Public Health Laboratory as well. Mm-hmm. Those are the main laboratories that we will be training from. So we have a total of 35 persons, and we also have Tobago. Let us not forget Tobago. Right. We have 10 persons coming from the Scarborough Hospital in Tobago, mm-hmm. who will be, when I say coming from, I don't mean physically, of course, but who will be part of this online training starting today at 9:30 and finishing tomorrow at around 12:15.
And Dr. Oura, tell us about UWI's involvement in this capacity building that's taking place.
Well, good morning, everybody. Yes, so there's UWI were asked by PAHO to help with the training, and we have a team already set up in the different faculties at UWI. So we're doing this kind of testing and teaching this kind of testing all the times in our labs. So we're very aware of what it's all about. And it's quite complicated testing, so it's important that people who are going to be doing it both know how to do it, but also they understand the principles behind the tests, so they understand the reasons why they're doing it, because it's all the more important to really know what you're doing as well as how to do it. So
Mm-hmm.
we have a lot of expertise at UE who we're bringing in to teach people about the background behind the molecular biology behind the tests, the principles of the actual tests themselves, which tests are best to use in different circumstances, which samples, etc. And then so that'll be today that we'll be going through this a basic introduction to all these areas.
Yeah.
And then, as Dr. Wheeler said, the PAHO trainer tomorrow will be talking about tomorrow we'll be talking about more specific COVID-19 coronavirus testing that the technicians will be doing.
Yeah, and in terms of doing this training remotely, does it impact the quality of the training in terms of not being able to be on site with regard to the execution, perhaps, of how the learning takes place?
I think it's important to say this is the start of the training. So this is the sort of introductory training. So this can very efficiently be done online. However, after this training, there will be more training to come, which will be more hands-on, which will be
Mm-hmm.
getting the technicians to actually uh, carry out the processes. People have to work obviously in biosafe environments, so they remain safe when they're doing testing, to fully understand that in the environment of the actual testing, where the testing is going to be carried out themselves, and to actually do the testing. And so what you do in this kind of situation is you have a system where you do a quality accreditation at the time. So people do the tests in parallel and you check the results with an expert. And so there's a process that you do to make sure that all the people that are doing the testing are proficient at doing the testing.
Yeah.
So it's not just today and tomorrow. The training will continue.
Yeah. And how soon after the training is complete do we expect to see some impact on the increase in capacity with regard to training? And also, what would that look like in terms of numbers of tests per day that is able to be conducted?
Well, obviously, when you're setting up a diagnostic capability in this kind of emergency situation, you need to have multiple people with the skills to do the testing, and you need to have to be able to have rotas of people who are running the testing in shifts. So it's very important that we have as many people as possible trained from the different areas. So we don't stress people out and put too much pressure on individuals. So a shift system will probably be set up, and need to have like maybe two or three or four people working within that shift, because there are different steps to the tests that need to
Mm-hmm.
be done.
Mm-hmm.
So that has to be looked at carefully, and will be supported very much in that by CARFA, who are actually have this system set up, and people at the UE and PAHO who have experience setting up this high throughput type testing system. So yes, your training needs to be to as many people as possible, and we need to train as many people, because you do need to have a core of people
Mm-hmm.
who are working in this kind of emergency situation.
Dr. Wheeler, what about the increase after? So we test about how many tests get done right now, and once we're finished with the training, what do we expect this number to go to?
Well, of course, it'll depend quite a lot on the reagents and when we get the reagents, because of course reagents are in quite short supply at the moment. But once you get the system set up, we should be able to manage a very increased input of testing to what we carry out now.
Yeah.
Should be able to support what's required.
Yeah. Dr. Wheeler, what do we expect on Wednesday? I think Wednesday PAHO is also doing the training. You referred to it early. What specifically would be done on Wednesday?
Okay, so on Wednesday we have Dr. Gresh, and he will be covering For example, I'll just read for you laboratory response. That's the overall area he's looking at specific to COVID-19, as Dr. Ora said. So he will be looking at the WHO laboratory based surveillance guidelines because, of course, everything needs to be done according to international standards.
Mm-hmm.
He's looking at sample type. He's looking at the laboratory setup for COVID 19 testing, as well as the protocols for molecular detection of COVID 19. And of course, Dr. Ora said there would already be some groundwork done with the 35 participants today, so that will prepare them better for the more specific area of teaching tomorrow. And finally, he will be looking at the COVID 19 laboratory biosafety guidelines, which is really very critical.
Yeah.
So these are the areas that he will be concentrating on Wednesday. And the follow up to that, as Dr. Ora already mentioned, there will be hands on training. So by the end of next week, these initial 35 participants should have a pretty good handle on what they need to do. And PAHO has already sent some of the material for testing. We already have the equipment for 4,000 screening tests and 1,400 confirmatory tests. And we actually shipped the enzymes last Friday. So as soon as the reagents come, and the government is expecting this to come from China. I'm not sure how soon, but very soon,
Yeah.
they will be ready to start expanding the testing. And of course, we will stay on hand to work with UE and expand the numbers of people who need to be trained as time goes on.
All right. Well, we're going to check in probably with both of you again next week, Tuesday. Dr. Wheeler is usually here on a Tuesday, and we're co-opting Dr. Oura now, who was here from the early days on. He was here early o'clock giving us information about the virus. I think as early as January we were talking to you, Dr. Oura, and but we have to wrap it. We have to leave it there. All success with the training, and we'll check back in with you next week, Tuesday, to find out how it goes. I want to thank you very much, Dr. Erica Wheeler, as well as Dr. Christopher Oura.